Hello, everybody. My name is Isabel, and I will be going over your 2023 benefits as a TLC employee. Let's get this on full screen. All right. Your open enrollment this year will begin on Monday, November 28th and run through Friday, December 9th. This is your once-a-year opportunity to enroll in benefits if you have not already. The only other chance that you'll have throughout the plan year to enroll in benefits is if you experience a qualified life event. Some examples of those would be a marriage, a divorce, having a child, adopting a child, if your spouse loses their coverage elsewhere. So there's a whole handful of qualified life events that would give you the opportunity to enroll in benefits outside of open enrollment. If you do experience one of those, please reach out to HR or the member advocate. We'll be going over their contact information shortly. And when you do reach out, just please make sure you do it within 30 days or else we won't be able to enroll you onto that plan that you would like to be enrolled in. Okay, let's get into the benefits. All the benefits we'll be looking at today will be for the 2023 plan year. So all benefits will begin January 1st and run through December 31st. You are an eligible employee if you're working 30 or more hours per week, and you may enroll yourself and your dependents. We have a couple pages in here with healthcare terminology. Feel free to refer back to this, back to these slides if you receive a bill or see, any information regarding your medical, dental, or prescription benefits throughout the plan year. I'm probably going to sound like a broken record by the end of this presentation, but you may reach out to the member advocate throughout open enrollment or the plan year for basically any reason that has to do with your benefits. So if you're having a hard time logging into EASE to do your open enrollment, please feel free to contact us. If you would like to discuss the benefits of enrolling in one plan versus another, please reach out to us. If it's past open enrollment and you're not sure if you're experiencing a qualified life event or if you received a bill in the mail and you're not sure how to read it, you really can reach out to us for anything. You can email us, you can give us a call, or we can meet face-to-face virtually. You will be conducting open enrollment through EASE, just like previous years. If this is your first time going through open enrollment, as a new hire, you should have received an EASE login. EASE is pretty user intuitive. It has the word ease in it for a reason. Just follow the prompts, follow the instructions. But with that being said, it is a system, and systems every once in a while can be really confusing. So you can always reach out to us, and we'll sit on the phone with you and we'll work through it together. We like to include this slide in here just as a reminder, the difference between urgent care and emergency rooms. An emergency room visit really should, in a perfect world, be saved for a true life-threatening emergency, and an urgent care for really anything else. So an example of when to go to the emergency room would be if you are having chest pain, difficulty breathing, loss of consciousness, a head injury. Don't take the chance. Just go straight to the ER. If you're experiencing something like a sprain, a cough, a fever, a flu, an urgent care would be probably the right decision for you. Of course, these are your benefits and your decision, and you can go to whichever one you would prefer. But we do recommend trying to save the emergency room for true life-threatening emergencies, just to save you time and money and a headache when it comes to the potential paperwork and claims you may deal with post-emergency room. But if you're unsure, please call 911 if you think you're having a life-threatening emergency. If you're not sure, you may call the 24-hour nurse advice line for the Kaiser or Anthem plans. That information is on the back of your ID cards. And also we'll be get into that contact information when we get to those plans. You might also call urgent care facilities nearby. Okay, so we're going to talk about the medical benefits now. We have 4 Kaiser plans. I'm not going to go into heavy detail, the benefits for each plan, only because I don't want to talk your ear off. And this is just a snapshot of the plans. The full SBCs, which stands for Summary of Benefit and Coverages, are available to you on Ease. So when you go through open enrollment on Ease, feel free to go through that document library and you can take a look at the nitty-gritty of each plan. But while we're on this page, one thing I want to note is that Kaiser is such a fantastic carrier, and their app is great to use. You can do doctor visits virtually. You can email your provider. You can take advantage of the 24-hour telephone health advice from registered nurses. You can look at your test results, make appointments, download your ID card. It's just so useful in today's virtual world to have access to that. So if you are a Kaiser medical enrollee, I do highly suggest downloading that app. And let's get into the 4 Kaiser medical plans. There's a couple things I want to touch on each plan, which is the network benefits, the deductible, and the cost to see primary doctor versus specialist. So for this plan, it is in-network only. You don't have access to out-of-network benefits. And what that means is you, of course, are able, I mean, it's up to you. You can go to an out-of-network provider. That is your prerogative. But unfortunately, you would be paying full cost to see that provider. With this plan, you need to stay in-network for the plan to pay. When we say for the plan to pay, I mean where it says preventative care $0, that's because you're staying in network. If you want to pay that $20 for a primary care appointment, try to stay in network, please. This plan has a $0 deductible and a $4,500 out-of-pocket maximum for an individual, $9,000 for a family. The way an out-of-pocket maximum is it's kind of insurance on insurance. It's the most you would ever pay in a plan year for medical benefits. And a handful of people do reach their out-of-pocket maximum. Once you reach the out-of-pocket maximum, you would not be required to pay to visit the doctor for the rest of the plan year. This plan has a $20 urgent care copay versus that $150 emergency room copay. So just another example of how cost efficient it is to go to the urgent care versus emergency room if it's not a true life-threatening emergency. All of these Kaiser plans that we're going over do include pediatric dental and vision as well. The second Kaiser plan is the Gold HMOB. This has a $250 deductible for an individual, $500 for a family, a $35 office visit, and $35 urgent care. To go to the emergency room is $250. All of these benefits also include prescription drug coverage. We'll move on to the Kaiser Gold HMOC. This one has a $0 deductible, just like that first plan we went over. All the plans will have $0 for preventative care as long as you're staying in network. We have a $30 office visit, $30 urgent care, and $250 emergency room copay, as well as prescription drug coverage and pediatric dental and vision. Our last Kaiser medical plan, the Silver HMOB, has the highest deductible of the 4 with $1,900 for an individual and $3,800 for a family. We have a $65 office visit, $65 urgent care. And you can see for emergency, ambulance, and hospital, we have a percentage instead of a dollar amount. The reasoning for that is that's a coinsurance and not a copay. The way coinsurance works is if you were, so for those coverages, the emergency room, ambulance, hospital, if you were to go to the emergency room before that $1,900 deductible was met, you would pay full cost for that emergency room copay. However, if you were to go to the emergency room after that deductible was met, then you would pay 45% and the plan would pay the remainder. All that to say that some plans have copays, some plans have coinsurances, and this has a mix of the two. If you would like to chat offline about this, about the differences between the two and the specifics of how that works, I'm so happy to sit with you and chat about that together. There are two Anthem Blue Cross medical plans. We have the Gold PPOE and Silver PPOC. We'll be diving into those benefits in a second, but I do want to note that the member website for this carrier is anthem.com. Anthem has virtual visits, which is really amazing. They can be accessed through the Live Health mobile app. I very strongly recommend downloading that app if you are enrolled in an Anthem plan. You can contact the 24-hour nurse line, message your doctors, make appointments, and download your medical ID card. Oh, something else I want to note is the reason why these plans don't have the rates outlined is because we do have them outlined in ease. So as you're going through your open enrollment, you will see how much it would enroll to cost in all of the how much it would cost to enroll in all of these plans for yourself and or your dependents. The first Anthem Blue Cross medical plan we'll be going over today is the Gold PPOE. One big takeaway from this that I want to call out is that you can see we have out-of-network benefits at the bottom. This is one of the biggest differences between Kaiser is you do have out-of-network benefits. You can go to any provider you'd like. You can go straight to a specialist. You don't need a referral like you would with Kaiser. But one thing to keep in note is the out-of-network benefits pay less than the in-network benefits, meaning if you stay in-network, the plan will pay more. And if you go out-of-network, you're going to pay more. So it's always nice to try to stay in-network to make sure you're getting the best bang for your buck. This plan has a $500 individual deductible and a $1,500 family deductible. A $30 office visit, $30 urgent care copay, and we have a co-insurance costs for emergency room ambulance services and hospital care. The second and last Anthem Blue Cross plan we'll be going over today is the Silver PPOC. We have a $1,700 deductible for an individual, $3,400 for a family, $50 for an office visit. To see a specialist is $95, and that's the same cost to go to urgent care as well. We have a co-insurance cost for emergency room, ambulance services, and hospital, just like that previous Anthem Blue Cross plan. You also have out-of-network benefits with this plan as well. And just like members enrolled in a Kaiser HMO plan, Anthem members also receive a pediatric dental and vision benefit at no extra cost. The schedule of network benefits is outlined on this page. You have in and out of network benefits for pediatric dental, and pediatric vision is a very rich benefit. If you have any questions about how these plans work, I told you I'm going to sound like a broken record. You can reach out to me. Okay, there are two dental benefit plans available. Both are voluntary and employee paid. The first one is the Blue Shield Smile plan. The second is the Deluxe Ortho plan. These two plans are exactly the same in network, except you get an orthodontia benefit with the orthodontia plan. So both have a $50 calendar year deductible for an individual, $150 for a family, a $1,500 calendar year maximum. The plan pays 100% for preventative procedures, 80% for basic, and 50% for major. And as you can see, that first plan does not include orthodontia, but the second one does, $1,000 for an orthodontia calendar maximum, which is a super rich benefit. If you are enrolled in these plans, you can find the dental PPO directory on blueshieldca.com. Just go to the Find a Provider section, and it should be smooth sailing from there, but I'm also happy to help you out. We also have employee paid voluntary vision benefits through USA Vision. We have the rates down at the bottom right-hand corner. Those rates have not changed from last year, and the dental rates have not changed either. That's always really great news when we can keep benefits the same cost, and TLC was able to do that for you guys this year, which is fantastic. For the vision plan, we have a $10 cost for an exam every 12 months. You have a frames allowance, and you also have an allowance for lenses, depending on the type of lenses that you purchase. Just like previous years, you have the voluntary life and AD&D plan available to you. The way this works is you would be enrolled for a certain amount of coverage, and if you were to unfortunately pass or experience a dismemberment, then the amount that you were enrolled in would be paid out to your beneficiary. If you're enrolled in this plan or planning to enroll in this plan, please make sure that your beneficiary information is correct in Ease Central. That is very important. Two other important things about this plan is you may enroll your spouse and child, but only if you yourself are enrolled. And we do have the monthly rate per $1,000 worth of coverage chart here in the middle, but we would never expect you to do that math yourself. The math can be done for you on eCentral as you're going through open enrollment. You can play around with it. You can see how much you would pay per month if you were enrolled in $10,000 versus $200,000. So no worries, you don't have to do any math here. The system will do it for you. Just go in and play around in Ease. This is just a worksheet to maybe help you decide how much coverage you might want to enroll in for voluntary life and AD&D. A lot of people try to factor in the cost of their mortgage, any loans. They have college funding for their children, overdue taxes. So this is totally up to you if you'd like to play around with this page, if you're interested in this coverage. And something so exciting is we have a handful of brand new benefits for the 2023 plan year, and I'm very excited to dig into these with you. So the first one is voluntary accident insurance. And the way accident insurance works is you enroll, and if you experience an accident that is covered under the plan, which basically every single accident is, if you experience an accident, if you're enrolled, then you submit a claim and Principal processes the claim and sends you a check for what that accident was covered for. So for an example, and all of the actual coverage amounts are on eCentral, but as an example, let's just say that breaking a bone is is covered for $2,000. Then if you were to break a bone, you would submit that claim to Principal and they would send you a check for that $2,000 and you could do whatever you want with it. You can put it in the savings, you can use it to pay off your health, pay off your medical bills, or you can use it to go on a vacation. It's 100% up to you. So that's the way the accident insurance works. You can cover yourself and your dependents. And the costs to be enrolled in this coverage are on Ease. And critical illness is also a brand new benefit, and it works very similar to the accident. This is also voluntary and 100% employee paid, but if you are enrolled in the critical illness plan and you are diagnosed with a critical illness after, then the plan pays out just like it does for accident. It's a very useful plan and it gives people a lot of peace of mind to be enrolled in these plans. Of course, it is up to you. You do not have to enroll in these, but TLC is very excited to offer these benefits to you to help round out your benefits and offer you the choice to enroll in something that might be very important to you. This is just a worksheet we have similar to the voluntary life to help you decide how much coverage you may want or need to enroll in for voluntary critical illness. And just like accident, all of these coverage amounts and rates are on Ease Central when you are going through open enrollment. Another very exciting new benefit is the voluntary disability insurance. Again, this is 100% up to you, but we're so excited to offer this. And we're offering both short-term and long-term disability. The way it works is you're eligible if you're active and full-time and work at least 30 hours per week, just like all the other benefits. With the short-term, the benefits begin on the 8th day for disability due to injury or sickness. So basically the way that would work is if you experience an injury or sickness that you're going to submit a claim for, the benefits begin on the 8th day following that injury or sickness. Short-term disability is paid out by the week. So the benefit percentage is 60% of pre-disability earnings up to a maximum of $1,700 per week, with a maximum benefit duration of 12 weeks. And with long-term, it goes by monthly benefits. So the monthly benefit is 60% of pre-disability earnings up to a maximum of $8,000 per month. And the benefit duration is dependent upon your age when the disability occurs. So if you're interested in enrolling these plans, or if you'd like to discuss a little bit more about how disability claims work, I'm more than happy to schedule a call and walk through this together. And lastly, we're excited to offer the voluntary MetLife legal plan. TLC already offers a legal plan, which I will get into in just a minute, but we're excited to offer the secondary one alongside of it, just to help round out your benefits, give you the option about what is really pertinent in your life and important to you. And the way this plan works is this is voluntary. But if you're enrolled in it, you have access to legal advice and services when you need it. So you and your family members can contact local plan attorneys and discuss legal matters on the phone or in person. Some examples of those legal matters are debt collection, defense, guardianship, even will and estate planning. I'm actually enrolled in this plan with my own employer, um, purely for the will and estate planning. It's so fantastic to be able to pay a monthly fee, and in your case, it's $19.50 per month, and be able to set up a will and a trust and advance directives. That's huge. So if that's something that you're interested in, you can roll in ease. You can also contact MetLife at that phone number down at the bottom to discuss more specifics with them. And like I previously mentioned, you still have access to Legal Shield and ID Shield. They also offer will preparedness if you need help with a traffic violation. They're dedicated law firms with direct access, so that you are able to contact them directly. And something that's really great that this plan offers is ID Shield, which is basically like credit monitoring, social media monitoring, monthly score tracker, transaction monitoring. I mean, so much is done virtually these days. And it's really nice to know that you have somebody in your corner tracking things in case something looks strange. So we do have the costs down on the bottom left side of this slide. If you're interested in enrolling in this plan, feel free to reach out to the member advocate directly, and we'll put you in contact with the plan representative. His name is Steve. He is fantastic, and he's been the plan representative for the last handful of years. And just like in previous years, you still have access to the Bank of the West Bank at program. I'm sorry, Bank at Work program. And the way this works is you can just walk into any Bank of the West and say, hey, I would like to take advantage of the Bank at Work program. My employer offers it. And you can pick between a range of specialized checking accounts, and you receive special rates and discounts for opening one up. This is offered through the group, but you deal directly with the bank. So if you have any questions about this, it's really best to head over to your closest Bank of the West location and ask for more information. It's really fantastic benefit. We did include your time off and sick leave policy in here, just so you're able to reach back throughout the year and take a look if you're need additional confirmation of your 2023 holiday schedule. But you're also always able to reach out to HR if you have any questions about the sick leave policy. And lastly, TLC is thrilled to be able to offer Tickets at Work for another year. Basically, the way that you would use Tickets at Work is you can log in and take advantage of gift cards, hotels, theme parks, shows, with so much of the world opening up again. after the last couple of years of the pandemic. It's really nice to be able to say, oh, we're going back to Disneyland. Let's take a look at tickets at work and see what kind of discount is offered. Or even, hey, I'm traveling for a wedding and it looks like we're going to be staying at a Marriott. I wonder if there's a discount. And I can tell you there is. So it's pretty great to take advantage of these corporate discounts like this. And that brings us to our legal notices. You are not mandated to read this. It's up to you. If you have trouble sleeping tonight, feel free to go through the next 5 or 6 pages. But I had a great time going over your benefits with you today. As a reminder, your open enrollment begins Monday, November 28th, and it runs through Friday, December 9th. If you have any questions at all about eCentral, open enrollment, looking at your benefits on ease, questions about who's a dependent, or if you've experienced a qualified life event, please reach out to that member advocate. I have a whole team behind me. My name is Isabel. You can ask for me directly. And I'm just happy to work with you on the phone, via email, and answer any and all questions that you have. And as you're going through open enrollment, don't forget that those new voluntary plans are just so fantastic and really, really round out your benefits in a fantastic way to have that extra coverage for accident and critical illness and disability, as well as legal. So I hope you have a great open enrollment. If you have any questions accessing the system, please don't hesitate to reach us. We are here to help. Thank you so much.